Hello, my name is Raul Rodriguez Torres. I am doing my oral presentation for ENC 1101, Professor Dr. Van Camp. Today is April 17th, 2014. The topic I'll be discussing is the abuse of our Medicare healthcare system. Now, the abuse of our Medicare healthcare system is extremely controversial, and this is something that has occurred since almost the conception of the program. The Medicare system was started in 1965 to provide health care for seniors that reach the age of 65 and for those that are disabled to become eligible for an affordable way to have health care. Now, it's comprised of Part A, Part B, and then also Part D for medication. The problem with the system right now is that it's, number one, extremely very expensive. Expensive because, for instance, if you see a physician under regular Medicare, you're going to pay 20% of the total visit each time you see a physician, no matter what type of physician that may be, whether it is specialist or an outpatient facility. The cost is extremely high. Now, the physician that is taking the Medicare is essentially part of the abuse in the system that is occurring. The abuse is financial, and the other side is the abuse of the fact that the patient is not receiving the proper care. And I'm going to give you an example. A physician that accepts Medicare is allowed to charge 110% of what's called the Medicare allowable billing rate to Medicare to be reimbursed and paid for that patient that they see. Now, someone coming into their office for a common cold and clearly has symptoms as such should perhaps receive a bill of $200 and the patient pays 20% of that for a copayment. Now, this isn't very profitable for the physician. Therefore, sometimes there are physicians that overcharge and overutilize the Medicare system by charging perhaps that same patient and billing Medicare a bill of $2,000 for areas of treatment and procedures and perhaps medications that were not necessary or medically needed. Now, this creates a situation of not only an abuse of the Medicare system, but a cost to the patient, a cost to every taxpayer that's currently still paying into the Medicare system. And this is something that is extremely inefficient, ineffective, and frankly does not work in terms of healthcare. So there's now been changes in the healthcare sector to control this. One solution, and I was involved with part of that sector, is the Medicare Advantage prescription drug coverage sector. HMOs, PPOs, these are all private insurance companies that are federally funded by Medicare but used to control and monitor the way that the Medicare money and the patient care is being given, number one, and number two, making sure there's preventative measures in place to avoid overutilization, overbilling, and abuse of the Medicare system. So there is that solution in place to try to fix and address the Medicare abuse in the healthcare system. However, it's still an ongoing cost to everyone as a taxpayer. I'm going to reference now factual information that's in an article recently referenced in the Associated Press. And the article reads that medical doctors are trying to rationalize the reasons for high costs and charges filed by Medicare due to pharmaceutical companies. Now, pharmaceutical companies and medications are extremely expensive. However, generic medications are not as expensive, and furthermore do not substantiate the overutilization and overbilling that is occurring on a daily basis within the area of Medicare and with our healthcare system. So in closing, what I'll say is that our Medicare system is being abused from a financial standpoint. The patient is not receiving the care that they really should be able to receive. And then number three, this becomes very expensive for the patient and all of us as taxpayers paying into the Medicare system. I feel the system should be eliminated and should be supplemented with something that can really provide adequate health care to those that are in need of proper health care, and also be able to facilitate a physician in terms of reimbursement, perhaps being more proactive with preventative medicine rather than focusing on medicine for treatment. And that's my closing statement in terms of the abuse of the Medicare healthcare system. And this is my oral presentation. Thank you for listening.